Dr. Hillary Lynn out of New York City, and we're going to discuss a wide variety range of topics today. But to start off, I'd like to get a little more information on you, how you practice, and what got you into direct primary care. I'm going to steal that part from you.
Sure. So I'm a primary care doctor at heart. That's what I started doing. I briefly practiced as an oncologist as well. So that gives a little bit of context to how I approach what I do now, which is longevity medicine.
Did you do a full oncology fellowship?
You know, the interesting thing is, no, I did not finish my fellowship. In the middle of it, I decided that I wanted to become a startup founder.
Okay.
And the extent of fellowship and beyond just seemed so long when I wanted to do something so badly. And so at that point, I was done with my internal medicine training. And so I was ready and trained to be a physician at that point. So I decided, rather than go on and do several more years of training in oncology, I was going to leave training and essentially practice part-time as a primary care provider while starting to build in the tech world.
Really? Okay, so number one, it's not easy to get into oncology.
Not easy.
So what drew your attention into becoming a startup founder versus continuing oncology? Because I feel like for the most part, physicians just go and then they go into maybe if they decide to specialize, they just go and finish.
Yeah.
So what attracted you? What kind of turned you around, or were you not sure when you were in the program?
I honestly was not sure of anything at that point in my life. And it was the hardest decision I've ever made, and also one that I don't regret at all. But at the time, it was so hard because you were right. Once you've made it to that pinnacle, it feels like, of your training career, honestly, it's still so early, but you've done decades at that point of all that schooling. And when I spoke to my program director, he was shocked. He was like, never in my 30-year career has anyone ever left at the fellowship stage. Mm-hmm. And it's because yes, there's still a few more years, but at that point, people are ready to finally begin their wonderful career as a medical oncologist. And really what got to me was I looked at what was ahead of me. I looked at my mentors, and they are wonderful, wonderful people. But I could see that they were so constrained by the system that they weren't able to do the things that they wanted to do for their patients. Mm-hmm. It's heartbreaking, and it's a horrible system, unfortunately. And I do still love the topic of oncology. I love working with cancer patients, but I just know that I can't do that in the traditional system method.
I really want to dial into that, but I'm going to first ask you, what startup pulled you away? What was it?
Yeah. So it wasn't a particular startup. It was a friend who was ready to start a company at that moment. And so put yourself in my shoes. I was in the beginning of my fellowship training. I had finished my residency, and interestingly, I had more time to sleep. So I had more time to think properly. And I had just made a big move. I was at Stanford for all of my school and training for over a decade before that, and I had just moved to New York, which is a brand new world. It's for people who have lived there, it's obviously a vibrant city. So I was exposed to so many more ideas, and not that Silicon Valley isn't full of ideas, it's just different.
You were also bombarded. How long were your shifts? Because it's changed so much over time, 12, 16, 20 hours.
Yeah. Sometimes you would be awake for 30 hours.
Okay, you were part of that crew. Yeah.
Well, it just happens. Even with the restrictions, they're like, you can only work for 24 hours. I'm like, but it means you're awake for longer than that. You have to drive there and home. By the way, very dangerous. So it was a friend who reached out to me. He was a second-time founder. He had done YC, and he was like, you know what? I want to build something with you. And I was like, you know what? I'm so ready. There you go. So I joined up with him, and actually that startup didn't end up becoming anything. It was the beginning of my journey. I started that particular company. It was around the cancer screening space. Okay. And we found out that all great missions do not necessarily become a good business model, is what I learned. Yeah. And but it dies on the profit and loss sheet. Sorry. Yeah. It was very sad, but it was a jumpstart to the rest of my explorations. Well, it was like a different kind of education. If you really think about it. Yeah. And it brought you into a new world, expanded your horizons, and allowed you to think probably
I would think very differently than
And
prior to that.
it got me learning on the ground. Like we did all of the things. Like we would run around malls and interview people, give them like Starbucks gift cards to talk to us like about their thoughts around cancer screening. You know, we did all the hustle things, and I enjoyed that a lot, even if all it taught me was that particular idea wasn't the right one. But then I went on to explore other spaces in sleep health and relationship wellness, and then eventually my first venture-backed startup was in the world of mental health.
Okay, hold on. Internal medicine, oncology, mental health. Okay, so what did you with the startup for mental health?
Yeah. So the story behind that was COVID had started.
Oh my goodness, yeah.
And
Everybody had normal mental health during COVID.
It was a time, and I happened to additionally have an additional stressor of going through a divorce at the time, and so I decided this is a great time to start a company, and it actually saved me in a lot of ways. Like when you have purpose, it gives you a schedule and it gives you a lot of direction and urgency. Actually, so it lifted me from the bad spirits of the COVID pandemic and got me going. I was excited to build in a very unusual way. Like in the early days, no one was seeing each other in person,
right?
And so
especially in New York City.
Especially in New York City, it was.
I'm in Florida. We kind of didn't listen to any of the rules. We were like, no, we're going out. We don't care.
You guys have sun and beaches, so you don't have to hang out. But so I met my co-founding team all over the internet. Like it was a bizarre time, and we eventually met each other. But imagine working with someone closely and deeply on something who you've never met in person. So
that's very interesting.
It was so fun. But one of the fun tricks that we did is before we met each other in person, we decided to guess how tall we were, and the only clues we had was we would stand like with a banana next to our heads and then like give each other like full shot views and be like, all right, guess how tall I am.
That's kind of awesome.
Yeah. So
it's funny enough, I did a business during COVID too, and I never met any of the people. I still haven't met most of them.
Yeah.
So I never even thought about that aspect of it.
Okay,
so you do that, you launched that one, it got venture backed, and then what happened?
So we were in the psychedelic assisted therapy space.
Oh, okay.
Yeah, which I'm still deeply a believer in and I love, but another space that proved to be a very tough business space to be in. Yeah. It's not one that's geared towards profit generation or revenue generation is what we've found, but it's an incredible modality.
I agree, but what got in the way? Was it the cost or was it the legalities of it? Because it's kind of difficult in the United States.
Yes. There are two things. One is regulatory, but the second is actually medical culture. And I say that because in a lot of healing modalities, the primary way you acquire new patients is by referral. And so if you could get referrals from therapists or from psychiatrists who were interested in sending folks to getting, and we were completely legally like above board. Like we were working with ketamine, which is the only legal.
Right, okay.
Yeah, so we weren't doing anything that was like gray area. But that still being said, there was a lot of confusion. There still is about is ketamine a safe substance to use? Unfortunately, there are people who do use it in an abusive way, and it's harmful that way. But the way we were doing it was so guardrailed. But that being said, there's a lot of confusion out there, and that restricted a lot of referral flow. And we just weren't growing as fast as a venture-backed startup, dreams to, aspires to.
Right.
So, yeah.
I think it's a great idea, but you ran into some of the problems with us outsiders run into when handling physicians and therapists and stuff. It's hard to move those patients. And they get a little stuck sometimes in their way and the way they treat, the way they algorithmically deal with those patients. I used to sell to doctors.
So you know.
I know really well. Interesting bunch.
And it's so funny because as a physician myself, I totally get that feeling, and it's pure feeling. It's we all like to say it's because we're evidence based, but it's not. I see evidence all the time supporting unusual practices. Just to take one that we all now know is great is hormone replacement therapy for women. Like the evidence all along actually supported.
Super hot topic. topic. Just remove the black box, right?
Exactly.
Go women.
Yeah. And now everyone you talk to is going to be like, oh yeah, I knew that was right all along.
Yeah.
But forever everyone was like, oh no, there's something off, because doctors don't have the time to dig through the research in detail, and it's like that saying, like, you won't get fired for buying Microsoft.
Right.
Yeah. So doctors know you're not going to get fired or frowned upon. Actually, doctors aren't even afraid of like lawsuits and getting fired as much as they are as being frowned upon by their peers.
Yeah. That's a good point.
Yeah. And so, and it's like that with the hormone therapy journey, like that with psychedelics, it's like that with a lot of longevity. We're here at a longevity conference as well.
We are. We're not going to tag you guys because you're not sponsoring us. I'm just messing around. That's really interesting. So you do that venture. You're doing these ventures. Did you start your practice around the same time? Like, what's the time frame here?
The time frame. So I started practicing at first as part of a different company. Like, I was a primary care doctor as part of a telemedical first company, also founded by Stanford grads, which is why I got involved with them. And that was good for when I started my mental health startup, because I only had a few hours a week to participate, and it kept my toe in the water. And then during the pandemic, I actually leveled up my hours. Like, I was practicing half time for a long time when I was in the pandemic, and then later I had to like bring that down to 8 hours or something a week. After that mental health startup, I actually converted my practice to my own, like a private practice, still telemedical, because I've now like been practicing telemedically for years and years, and it's my forte, and you can do like 90% of everything telemedically, is the truth. And so now I've converted it to a longevity first, still primary care, but longevity first practice.
And it's still telemedical.
Still telemedical, yeah.
Okay, so for the 10%, I want to go into what that is. So let's talk about what the 90% is, and I'd like to know what do you do with those 10% variables?
Yes, of course, yeah. So the 90% is your day-to-day things. Like, people are still coming to me wanting to know like an assessment, so I can order them lab tests, I can order them medications in response to things that we find. I treat, people, they come to a longevity specialist and you expect a certain thing, but at the end of the day is they still want a regular doctor.
Right.
Like, you get a UTI, you get like whatever it is, you need a new dose of your statin. And so I'm taking care of people with very much everyday primary care concerns, as well as some of these more extensive assessments and treatments that we do in longevity. And the 10% that I can't do are in-person things. I mean, at the very basic, it's even lab tests. Like, most doctors don't even manage that in clinic. You send them to a Quest or LabCorp. So, but then you've got like the more advanced testing, like VO2 max testing, DEXA scans. And so I work with lots of different providers. I'm totally agnostic. Like, there's no financial relationship. So I just send people to wherever they're located. I'm licensed in 6 states. So my patients are all over the country. And so sometimes I have to help navigate them. If it's a town that I'm not familiar with, even, like, I'll search with them for a particular item.
You don't have to agree with me. It's okay.
Yeah.
We could fight it out. I'm just kidding. But so I think your basic health is part of your longevity, right? Yeah. So we have to get it in order to optimize the rest of your health. Yeah. So it totally makes sense that you're doing that and bringing it all together. But what are some of the things you do in the longevity world that, like, what guidance are you giving? What is like kind of your thought process?
What's different? Yeah.
Just like, how are you practicing longevity medicine?
Yeah. My view of longevity is that it is just way more ambitious, preventative, evidence-based medicine. And I say that because lots of people have different views. Like, some people will define longevity as all the cool stuff, like stem cells, peptides, like you name it. And I'm like, yeah, that could be included. I actually don't exclude that necessarily. It's just another set of tools for our gigantic toolbox. I say it's ambitious and it's aggressive in that I will treat people before guidelines say to. Like, I I will check your lipid panel and your advanced lipid panel, even if you're 18 years old, and if it's going in the wrong direction, I'm going to aggressively treat that because I care about what your life looks like in 50 to 70 years, not just what it'll look like in 10 years. And so that's not guideline-based care, because guideline-based care relies on calculators which are trying to find if you're going to get a heart attack or stroke in 10 years. And I'm like, by that time, there's very little you can do. Like, a lot of damage has been done.
A lot of damage has been done, 100%. Yeah. I always say, like, insurance covers things after they happen.
Exactly.
It's so sad. It's like, no, you shouldn't do a calcium score unless you have a heart attack. Like, what? It's really interesting.
There's a lot of hoops that you have to jump through with the insurance system. And actually, I find that it's quite sad that, so it's true that doctors with more experience are better to work with, but part of the reason is because more experienced doctors know how to jump through hoops.
Navigate the system.
Which is such a terrible thing to
It's like the worst storm and sea in the boat you're trying to guide it to land. And
I'm just like, that's sad. So, like, as a very small example, I myself, I have like a familial, like, genetic version of high lipids. And so at a young age, I was like, oh, I've got bad lipids. And I basically jumped through the hoops myself for part of it and got all the testing necessary, but then had to, like, refer to cardiology and then get certain sort of imaging tests. And then finally, that's what qualified me for, like, a more advanced therapeutic covered by insurance. I'm like, that was a lot of hoops, but I knew how to drive the boat towards that direction. And many people don't know how to do that.
Yeah, and even when you have a direct primary care concierge physician, they're still running through these hoops when you need to get something or clear a medication. And that's sometimes why you have to go to cardiology, although your internal medicine doctor could totally handle it. But the insurance requires it. And then the medication's $1,000 a month. So you're going to go see the cardiologist. You know, like, that's so interesting. But yeah, I think, what is it? An ounce of a pinch of prevention is worth a
you started an ounce of prevention is worth a pound of cure.
And I don't know why we don't think about this any other way. So they tell you start saving money early for retirement, put in your 401k, all these things, but we're not looking at it's very reactive. So we want to keep numerical values over time so we can assess data dive, and then you can do your job, which is let me keep you as healthy as possible. I always say we live in a sick care nation, but, like, this is where everyone's going. We're here. There's thousands of people at this conference. Like, it's wild, and all sorts of different vantage points and viewpoints, and you name it, and it's very interesting in that respect.
I've had so much fun just checking out, like, the speakers. The exhibit floor has been eye-opening. And not that I haven't heard, because, you know, you're in this space as well. We've heard of all of these things, but it's almost more of how it's being presented to the consumer that is very interesting to me. So.
It is interesting too, because I'm assuming it happens to you. They come in, they're like, hey, what about this? And it's like, well, what do they say? Like with these commercials and stuff, like, what are they doing?
There's a lot of promises, and there's a lot of, like, fancy, glossy marketing, and it totally works. Like, I see, like, I can tell myself, I'm like, oh yeah, this one was very convincing for me, and it wasn't anything to do with the actual product. It was absolutely the storytelling and the marketing. So
a good story goes very, very far. So, you know, I went to a speaker a couple hours ago, and he was talking about prevention with the heart and plaque and all that. It was just, people were asking a lot of really good questions, but it was about that. He's like, I want to see, I don't want to see the progression. That's the whole point, right? Like, we caught this, let's not have progression. Let's see if we can even maybe back it down a little. And it was just a really interesting take. Now, you've been doing this, we've been doing this, and that's fine, because you have to be very aggressive in these things, because 10 years, 20 years down the line, you have all this plaque in the wrong areas, and you have a humongous problem. We're rushing you to get a stent or something, or worse. But it was just so interesting to see how aggressive, and he's like, no, this is it. We have to pay for it. We have to get it done, and that's what I require in my practice. Unfortunately, not everyone has access to that. Like you said, sometimes you have to wait until things are going wrong. We both said that. But yeah, it was a really good talk. I've enjoyed a lot of the physician-led chats thus far.
Those are, you know, I'm biased. I'm a physician, but I think
I'm not biased, but I'm looking for information I believe is probably going to be, like, useful. I
often, we live in the age of AI, and everybody is like, is AI going to replace replace doctors. I'm like, it's going to be, I actually do believe it will happen. It's just that it's going to happen in a very like different way. Like it's not going to be these generalized LLMs, like, just replacing doctors overnight. I think it's going to happen once people become more and more familiar with medicine, and they, as operators of AI systems, can understand the information well enough. Because that's the difference right now. Like doctors use AI as well, but we just understand the answers better because there's, we've had years of physiology training and education to understand what it means and when it matters and when it doesn't. And right now, the general consumer doesn't have that experience. Right. They're just going in sort of like with whatever problem they asked about, and then they're just like, okay, it could possibly be this, but you need to have clinical discernment, and that is going to take a few more years for the general public to understand.
So you did tell me you're interested in AI. I want to keep going on this topic.
Sure.
So you do believe it's going to eventually replace doctors, or it's going to do something else?
I think doctoring is just going to be redefined. It's going to be a totally different definition. So back in the day, doctors meant a certain thing. The doctor was someone who knew your whole family
right.
for generations and came to your home. Obviously, we don't have that anymore. It's very tragic, actually. Like that's what people still want. It's like a nostalgia for something we never had. And now, basically, your doctor is who you go to when you're sick, unfortunately. And very rarely, some people still have a true primary care type physician who they actually get in touch with when they're well still. But that's not really the reality anymore.
No, not unless you're paying for it.
Exactly. And I actually just did the numbers on this because I was curious, like how many people pay for a concierge type or DPC type. DPC is like almost not a 0.1%. So I didn't even count that. But about 0.6 to 0.9% of the US population pays for concierge care. And that's like nothing. It's a few million, basically. And that's the real primary care version. So in the future, what I think is going to end up happening is that we're going to have doctors who are that human guide, that navigator to help you through health decisions. But then everyone is going to rely on a more standard source of information. Say that's AI assisted in some way, or there's a source of truth that we can all rely on. But that human guide, the doctor of the future, will be the one who can help you evaluate, like, what does that mean? Like for example, I worked in oncology, and a lot of times we tell patients like an option. We're like, okay, do you want to do radiation or not? And then the patient's like, I don't know, like you tell me, because what is the pros and cons of either or? And they often will be like, whatever will help me live longer, right, is what they'll say. And then the doctor has to explain, it's like, okay, but then there's like a X% chance that it will lead to maybe heart fibrosis in the future, or you might suffer from X, Y, and Z horrible thing, and radiation can lead to fibrosis that causes pain and so forth. And then the patient's left with trying to imagine like what that all is. So at the end of the day, even with the facts, the doctor is still very valuable due to just having experience with many similar cases. So
I could totally see that.
Yeah.
I think it's going to unburden a lot of the system failures from getting an appointment through speaking to someone. The systems become so big and so bottlenecked. I think that's it. I agree with you on that. I think you're going to have also more access to information faster, and be able to look at things differently. And eventually, maybe we'll get through all these technological problems where none of the EMRs or anything talks.
Interoperability is still a problem.
Still a huge problem. But I think it's going to be interesting because you're going to have someone that can, even with more information, give you even better information, and we should have better outcomes. Even people that are busy in the hospital and stuff will have access to more information, better information. So I think the outcomes will improve. Hopefully patient care improves from under the physician, everyone else that touches the patient. But it will take over in some respects. It won't take over in others. The people answering the phone. I hope nobody sees this from my office. AI. But I'm just messing around. Not really, though. But what else do you like in the AI space?
I think AI is simply like a communicator assistant. Like, you've maybe heard of this statistic or study where they tested AI responses from an EHR, like a portal, and versus clinician responses, and patients uniformly like the AI response is better.
Of course.
And it's because, the AI it just generates, right, a full-fledged, very polite, considerate response.
Yeah, it's nicer. It's not fact. It's not like hard, cold fact. It's like nice.
And then the clinician's just like, yes, no, like, I don't know, like, it's okay, fine. Like, it takes a long time. Like, people always want to believe that their doctor is there for them and only them. And I wish that was the case. Wouldn't that be wonderful?
It would be wonderful.
Yeah, but unfortunately, doctors, especially in today's world where there's such an administrative burden, 99% of time is unfortunately spent away from the bedside.
Yeah. It's not, they don't have the time to actually do what they really want to do.
Yeah. It's so unfortunate. And that was a big part of why it was easier perhaps for me to make the decision to leave traditional medicine. I was just like, no one's doing what we imagined we were going to do. Like, this is a horrible way to practice medicine. So
just marching you right into the fire, baby. Okay, so we talked a little bit about your practice. I think that's awesome because you've kept like the COVID thing going. You've always kind of done that thing. You have a startup, right? I'd love to talk about the startup. You always have something going on. It's so exciting.
It's personality. Like a lot of my physician colleagues, they're so curious now. It's becoming more popular now that everyone has agreed that we're all burnt out for clinicians to seek alternative type careers. And I kind of mention, I call it a portfolio career because a clinician has a lot of skills, like obviously the clinical skills, but we're all meant to be educators as well.
Right.
Like, most of what we are supposed to be doing is educating our patients how to make health decisions for themselves. And so we're good educators, we're clinical thinkers, and there are some extras that are a little harder to learn, like business savvy and storytelling, marketing, like that is important as well, and doesn't come naturally to everyone. And then the big part of founding companies that really tickles my brain is solving problems, big problems. For example, the reason why I started the psychedelic assisted therapy company was I was seeing so many patients in my primary care who were there for depression and anxiety, and you talk to them, I'm like, oh, let's exercise more, eat better, and then see a therapist. But at the end of the day, they're there and they're like, they want an SSRI, they just want that pill. And I was like, I think psychedelics was a more powerful way to get to that solution. So I was thinking outside the box to solve a problem that everyone just saw the status quo as being there forever.
Right.
And
it's been for a very long time. The same treatment algorithm.
And
I sold an SSRI a long time ago.
Oh, really?
Yeah. I'm very familiar with it.
So, and it's still the same as we speak, years later. So, so with this new company that I'm building, CareCore, it actually grew out of my own experience. So I had built up more and more of a content following as a longevity physician, because what I love about longevity is that it's so new. So there's so much to talk about. So I started a YouTube channel, and then soon after, like all the other platforms. But and then my following was like asking, could I join your clinic? And I'm like, there is no way I'm going to see even hundreds of patients. I know some clinicians do, but I have an appetite for more of a micro clinic, so a few dozen patients at a time. But at the same time, I don't want to leave people hanging. So basically what I'm creating is a way for a clinician or even another type of educator, creator type of a person to stand up a digital telehealth company. And we manage on our end, the back end, a network of physicians who's actually doing the medical oversight. So it's almost like having a referral network, but under your brand. And you can offer medications, you can offer lab testing, and so forth.
You're integrating everyone.
Exactly.
Where everyone's kind of always been on their silos. I'm glad I didn't ask you this because I wanted to hear it.
Sure.
Like, you told me a little bit. I was like, I'm going to save this for tomorrow.
Sure. Yeah.
So because everybody acts on the silos. So you're just bringing everyone together so they have access to different tools and different people.
Yeah.
You have like a medical board basically, or like directorship, but it's more like a medical board that you can utilize as needed to give the patient the best care. Exactly. And the doctor can chime in and say, hey, and help that person as well.
Yeah. And the whole idea is, this is early days for us, but the vision in the future is that we can do so much operationally that the healer at the end of the day is free to just be a healer.
Right.
Yeah. Like no worry about any of the admin, the bureaucracy, or any of the legal stuff even, because we take that and we put it into essentially a platform as a service.
You're doing like what medicine should be. Like pulling out
that's our
all
dream.
the bad stuff and keeping all the good stuff of what it was meant to be. Oh, that's interesting. So you like reprogrammed your own little ecosystem.
Of
different kind of providers. Who do you see on your platform? Obviously, you have the physician aspect taken care of.
So about half of so we're still in like letting in people very slowly on a wait list. So we have hundreds of people now, but half of them, interestingly, are clinicians and half of them are not clinicians. And the non-clinicians, some of them are, some people will call them clinicians as well, but basically they're like coaches, so they're unlicensed practitioners in healthcare. They might be nutritionists, they might be, more, there's a variety of like healers that have joined. And there's also wellness brands. And I say wellness because they're not clinical already. They're not offering like medications or lab testing, but they might have a gym or they might have a supplement brand of some kind. And some folks, there's a small group of folks that are pure creators. So their main business is their content.
Their content. And so how does that integrate with the ecosystem?
Yeah.
If they need something.
Yeah, because we manage everything from the medical intake on for them. Yeah. And so it's like handing off to your team. One analogy I sometimes give is Mark Cuban's Cost Plus. So Mark Cuban is the face of the brand, but he's not the pharmacist and he doesn't even own the pharmacy. And so that's essentially like whoever partners with us is like the Mark Cuban of the brand. And we're bringing all the ops.
So you're basically like, that's so interesting.
Yeah.
I had a way to say it. You could be a face, you could be a brand, but you're bringing like the whole board, the whole business, everything they would need to execute, as long as it's within something of healing or wellness.
For health brands. Yeah.
Oh, that's so interesting. Oh my gosh, that's like like kind of like doing medicine without having the overhead of a space. Like
absolutely.
That gives a lot of freedom to whomever wants to enter the space. Or whoever should enter, because you're allowing people in, but whoever you deem worthy of entering the space. That's so cool. I really like that. That's very interesting.
I think so. Yeah.
I'm going to bring up someone's name when we're off camera. Maybe you should run into him.
Sure.
So we talked AI, we talked startups, we talked you changing your whole career from a medical standpoint, and what you're doing with that. What other topics? I feel like we hit most of them. Was there another topic I'm forgetting that like?
No, I mean, I think one thing I'll just mention is there's the traditional healthcare system, which is by far and large still the main version of healthcare. Like we like to believe that longevity is becoming a huge thing here at this conference and with the people we interact with, but the reality is it's 1%.
Right.
Yeah. So I am still optimistic, even with those overwhelming odds, though, that consumer first healthcare will, at the end of the day, be leading the future of healthcare. And the reasons for that are, healthcare insurance is shrinking with what they will cover. And I am growing. I have a lot of colleagues who have convinced me towards this mindset to believe that actually primary care perhaps shouldn't be included in insurance covered care. And the reason is that it's like any other insurance, like your car insurance. You don't expect your car insurance to cover things like oil changes. And so why should it be covered? And then there's a counter argument of public health should include more.
I've read the op-eds and stuff on removing primary care from insurance.
It's because I think by including it in insurance-based care, we're just strangling primary care is the truth. That's the reason why primary care physicians are forced in that model to see people for like 5 minutes at a time, because they don't get reimbursed very much.
It's horrendous. I've talked a few times on this podcast about it. Or all the time to everybody that listens. It's horrendous. Several $100,000 deep in education costs. You guys are, for the most part, very smart, brilliant people. And then it's like, here's $10, here's $20. You're like,
it doesn't make any sense.
No, it doesn't make an ounce of sense.
Some things obviously got to change. And I think consumers are leading the push because people are finding their voice. And I think it's a great thing. We used to call all of these topics simply wellness, and it was strictly outside of healthcare.
Right.
But now people are demanding an element of science and evidence-backed level of all of the modalities. And that brings it squarely into healthcare, into the clinical world. And we're pushing on those doors, like for traditional healthcare.
I'm a believer that clinical relevance should be still led by the physicians, which never have time to do that. And now we're seeing the physicians coming back into that game. You have an online presence. A lot of physicians are starting to have an online presence, which I think is wonderful. But there's still the other side of it. And I've even seen it at this conference where it's like, I was telling my colleague, I was walking by to go to the expo and someone's like, don't trust your, I tell you this the other day, don't trust your doctor. I was like, what? I was like, you have the wrong doctor. So it's created like an opportunity for non-clinicians, which by the way, non-clinicians can completely help in the healthcare system and the wellness industry. I think working together, like your startup, is what needs to happen. I think there's been a lot of, like I said, silos. Everyone's separate, and it gets really interesting there with the referrals.
It's not either or. It's like it's and.
It needs to be, and then we hit it from all aspects, and whether you need a personal trainer, a chef, a nutritionist, or here's a YouTube channel of cooking healthy food. The information needs to be solid. So that transition and bringing that in is being led by the longevity doctors, right? It's being led by the mainly direct primary, cash pay, and concierge membership doctors. And I think that's happening. And not all consumers can do that, but now there's enough information between AI and maybe being able to catch someone online and get someone's ear for a bit and figure it out. And when you're putting content out, and other physicians are, it's educating the consumer. And so still make sure that what you're buying is, it's like all the toothpaste is like the ADA, right? American Dental Association. It should be like, this is approved by the American Physicians Association. But it's definitely going the right direction with that. And, and we have people going way to one side, way to the other, but it's going to all work out. And you all are leading the charge. So I'm super excited for it. It's my favorite thing. I get to scratch my itch and, learn how to be healthy for myself. I get to still talk to doctors, which I miss from medical devices, and being I miss being in the OR as well. I don't miss all the paperwork.
Oh my goodness.
I've been being around chasing people down to get paid. But I do. That's why we started this, to give, I think physicians should lead the charge. And I'm not one. And I'm so glad at a place like this that there's so many leading the charge, so many learning or coming here to see more things. And it's going to be a super exciting time as we continue to push the envelope of healthcare, what it should be and what it can be.
Yes, absolutely. Well, thank you.
It's been an absolute pleasure. So, thanks,
this is a fun chat.
I told you. We just continue our conversation for the other night. So
this is great.